So, very warm welcome. Thank you.
Thank you. Good afternoon, everybody. As said, I'm John Hopkins from ePad, and what I want to briefly talk about today is improving the outcomes in our health economy and how we can go about doing that. I think most of us know what the problems are within the NHS. It's not the fact that it doesn't work, it's the fact that it's under a great deal of strain. The aging population is growing exponentially. A figure I heard a few weeks ago when I was on the other side of the Atlantic is that every day 10,000 people in the US turn the age of 65. So you can extrapolate that back to the UK, so about 3,000 people turn 65. So there's an ever-increasing burden on the NHS with long-term conditions and comorbidities around that. So how are we going to deal with that? It's not the fact that the NHS doesn't work, it's the fact that it's being overwhelmed by the conditions, the patients with their conditions that are out there and need to be supported and managed in the community. So what are we doing about it? One of the things that we're doing at ePad is bringing forward applications that will help support patients within the community as well as in the acute sector by connecting those patients back with their clinical support teams. So we're looking to reduce health costs, focus on patient monitoring, intervening before they hit crisis point and end up going through A&E and then being admitted into hospital. Alerting physicians and clinical support teams out in the community about the changing nature of the patient's condition. So keeping them informed. The whole point about moving away from the pre-planned care delivery processes that we tend to have at the moment into self-management of patient conditions, which everybody's been talking about recently, is that self-management is fine, but it actually needs support from the clinical environment as well. And to do that, the clinicians actually need the data about the patient's condition on an ongoing basis. So we need to be able to get away from this 6-monthly visit with the doctor and the question being asked, so how have you been? The clinician really needs to know how the patient has been and can have an informed discussion with the patient about their lifestyle. So presenting that information back to them, back to the clinician, is key to self-management. It's not an isolated thing. So the whole point about ePad, Meditrax is about connecting that data back to the clinician and completing that circle. So how are we taking this forward? What are we doing? One of the things working with the AHSN has brought to us is access to the clinical environment in the Northwest Coast, and we work closely on a recent small business research initiative opportunity, which thankfully we won, and the input from the AHSN was key to that, I believe. So we're moving it forward not just in terms of patients being able to input their own data, but into monitoring patients using remote sensors, so wireless sensors, so that they're attached electronically and can feed the information back automatically. The element that we're doing at Alder Hey, and it was spoken about earlier in one of the presentations, is to produce transdermal sensors so that the effect of that means we don't have to take blood samples to look at some of the blood constituents, some of the biochemical markers that are in the blood, and feed them back on a regular basis. One of the things we're looking at there is lactate in blood and also pH, but we'll also be moving that onto a whole range of other biochemical markers, and they feed into the system and can be displayed easily so that so the staff can react quickly to any changes in the physiological condition of the patient at any time. As you can see, some of the sensors at the bottom there, they're quite small. They're the size of your thumbnail. Now, these sensors are quite old, so we're now looking at a sensor that size actually having 5 or 6 or 7 sensor heads on there, so we can detect on something the size of a 50 pence piece, 5 or 6 different types of biochemical constituents of the blood and the changes in those. So that's moving forward, and where we're going to connect both the acute information up together and also information from the community back into the support services out in the community. So working with the AHSN, one of the things that we've sort of, I've worked with the NHS for a long time and I've been through many, many changes for 25 years. Different organizations, different structures that are there to engage with the commercial community outside. And I have to say, the last 12 months has been a breath of fresh air. I've actually been dealing with people who are outward looking. They're looking to find innovative products that they can present to their clinical colleagues, which is refreshing. Normally, in the past I've had several meetings that actually end up with nowhere because people have been really paying lip service to new innovations because they don't really know how to engage and deliver those. One of the things I've found about the AHSN and the team that we're dealing with within the Northwest Coast is they're actively out there looking. They're actively out there trying to bring clinical need and innovation together and talking to the SMEs who are actually out there presenting those innovative products. They're also focused on the benefits to the NHS, so it's not just about new gizmos, new ideas that can, sort of deliver fancy stuff. It's about bringing benefits, doing the health economic research around that and delivering that as part of the whole package back to the clinical teams. So as I mentioned, it's bringing together the three areas, the clinical teams, the NHS, academia. On the Alder Hey sensor technology, we're working with John Moores University to deliver that SBRI contract. That work, bringing that together, is very, very important in bringing innovation into the NHS, which is what we're all about. The other thing I would say is that the team that we're working with in the AHSN are very knowledgeable. They actually come from NHS and from the commercial end, and they've brought that together very well. So they actively are seeking to engage with SMEs out there, and they know how to engage with them. They've got excellent links with the clinical teams out there, so the things that companies like us, who are at the very small end of the SME group, they can give us access to those clinicians who can provide us with patients for trials, how to get through that. As a small company, that's very, very difficult to achieve. So the AHSN have been very instrumental in being able to present us with clinicians who are forward-thinking, who can actually deliver the services that we need to get a product through and tested and delivered. They're very approachable. Over the last 12 months, we've had many meetings with them. They actually bring things to the table, openly discuss the pros and cons of things that you're delivering, and I'm quite happy to say to you, no, we don't think that will work. Why don't we try this way? So it's a collaborative delivery of innovation into the NHS. And just the one thing I'd finish up with, especially about the Northwest Coast, so if you engage with them and explain what your concepts are, they will bring opportunities to the table. That's what I've experienced. That's what's happened with us. The Alder Hey SBRI contract was brought together by the AHSN presenting to us and bringing that opportunity together. So my experience has been that the AHSN in the Northwest Coast is an excellent organisation that really has opened up the NHS to a very, very small company. So I thank you very much for that. Thank you.
Great.